is Professor Dr. Natrajan, a Padma Shri awardee, a famous vitreoretinal surgeon who's already in the Hall of Fame. We all know his Guinness records of doing the maximum DR cases. He's held up many positions as president. He's been a leader and a visionary, and today he's here as a president of Teleophthalmology Society of India. I welcome you, sir, and thank you for coming in to this session. Now I would request Dr. Natrajan to please tell us, yes, we heard teleophthalmology, telemedicine societies. Where is teleophthalmology heading to, and how does teleophthalmology see this come into the picture?
So with this, I think I chose a topic of co-management by ophthalmologists and optometrists in India for eye care using the tele-eye health care services. So the teleophthalmology is a branch of telemedicine that delivers eye care through the various equipment with using the telecommunication technology. And I want to make sure that the ophthalmologist along with optometrists can do all of this which is mentioned here. And teleophthalmology practice in India from beginning, Shankar Netralaya, our Aditya Jyoti Hospital, Mumbai, Arvind Eye Care, Madurai, Wellcare Health System, Chennai, Tripura, Teleophthalmology Network, AIMS, New Delhi, Jipmer, L.V. Prasad, Narayan Netralaya. I've just given a few who are pioneers in teleophthalmology. I'm sure many more are doing that. And the objective of the teleophthalmology objectives is like a service center. Actually, this is a Shankar Netralaya Telehub where they are doing for other ophthalmic hospitals for second opinion through mobile van, continuous medical education, higher learning center, mentored procedure surgery, and higher research organization, and also public awareness. So this is the Shankar Netralaya Teleophthalmology mobile unit with internet. They have inaugurated as early as 2003 in the 10th October. And I'm sure I remember Dr. Abdul Kalam as the president also came and inaugurated expanded the program. And providing urban facilities to the rural area through mobile ophthalmology unit, comprehensive eye examination in rural areas at the patient's doorstep with spectacle dispensing, diabetic retinopathy screening camps, eye screening for school children, and awareness on eye ailments in rural areas for the public. This is again a mobile refraction van. They only had a refraction to be done in the van. And these are the 2003 to 2020. They have done about 3,000 camps, and total number of patients examined is about 6 lakh people who benefited from this. And the Arvind Care system managed by Dr. Kim, Dr. Nampar Malsami, they have a vision center for every 50,000 population, permanent low-cost eye care facility to reach the unreached, aim to provide primary eye care and referral services, manned by a trained technician and linked to base hospital with wide bandwidth, more than 7,36,414 teleconsultations they have done. And this is how they do with the registration, the vision center process, the data being sent back and forth, and I have seen this happening there. And Tripura Vision Center project, where it comes under the Ministry of Health and Family Welfare, again have eye care service to the previously unreached rural citizen, Department of Health, Government of Tripura, and ILFS and ETS with help from Arvind Eye Care. The Vision Center database server is located in the Indira Gandhi Memorial Hospital premise at Agartala, the state capital. The project serves a rural population size of 27.18 lakh in the remote areas, covering 45 blocks in 8 districts in state of Tripura with 40 vision centers. Similar things should be done by every state. And the other example is L.V. Prasad, the Eye Institute. They have the pyramidal model of eye care. They have the community, primary, secondary, tertiary, and advanced tertiary. And AIMS have video consults clinic for all departments launched on 14th November 2016. And during this Corona, I think they are discouraging normal OPD patients to come. They are using telemedicine for treating patients. The other business model, Wellcare Health System, my friend Dr. T. Senthil, who's an ophthalmologist, but an entrepreneur with a lot of private preventing blindness through affordable telemedicine technology system, which is a very successful businessman too, but using the private practitioners to do it. But everywhere I see it is an ophthalmologist who's running it and not directly with optometrists or any paramedical. And the other is an innovative diabetic retinopathy care model, where equipment deployed in a diabetes hospital, then using the software, OPD screened by technician, nurse, and images uploaded to Forest Cloud server. This is done by the Forest. I don't have any financial interest. Images viewed remotely by ophthalmologists, and final fund of the report is sent back to the person who's operating the system. And I think Karnataka Internet-Assisted Diagnosis of Retinopathy of Prematurity, the KidROP, Dr. Anand Vinekar from Narayana Nethralaya. It is based on the triple T philosophy, TeleROP, training of peripheral ophthalmologists and ophthalmic assistants, and talking to neonatologists, pediatricians, and gynecologists. And a KidROP has trained technicians to screen infants in peripheral center, and a RedCam shuttle and store, read, analyze, grade, and upload these images from the rural center. It's using an indigenously developed internet-based PSCS system, which allows delivers through these images live to the remote expert on his or her iPhone or PC or iPad, and receives live report delivered to the internet-based server for the technician to read and provide. If you see here, everywhere the role of the technician or optometrist is there. So the role of an optometrist as a future leader, and that's my point here. I'm an ophthalmologist. My brother is an optometrist. My father was a renowned eye surgeon, and as well as the head of the first cataract camp started by the then Chief Minister Karunanidhi in 1972. When both me and my brother were in school, we were writing notes as volunteer, and we know the importance of optometry, and we know the role of me as a vitreoretinal surgeon, the role of optometrist, and me as my father as an ophthalmologist. He's no more, and my grandfather. They both were experts in refraction, and that too they mastered the Duke Elder's book on refraction. And I always used to hate it because it was so many questions they will ask me, and as an ophthalmologist I used to fail answering. But I'm glad I have a team of optometry in my hospital and my foundation in Dharavi, as well as I have an optometry school, fortunately recognized by Maharashtra University of Health Sciences. Thanks to Dr. T.P. Lahane, the Director of Medical Education and Research, was renewed our license to start the optometry college, which we are starting shortly now. And this is according to me, optometrist is and will be the first point of contact with patient, whether it's UK or US, where they practice independently. And here we have people like Ajit Bharajwaj and Monica, where they are practicing, and people are like in my hospital, they are attached. And the first point of contact is optometrist. And then having expertise in diagnosing, our Aditya Jyoti Hospital is ably managed by a team of optometrists during the COVID crisis, and either before or after, early detection and preventive care, advising patient to seek timely intervention from ophthalmologists, and education the patient on the health of their eye. So the symbiotic relationship, the only forward, here we have the Zeiss optical company, and franchise-based model for teleoptometry, webinars and corporate events, and we have to leverage all this. So ophthalmologist and optometrist working in partnership, patient visits optometrist, optometrist diagnosis about the patient, optometrist provides opinion, diagnosis result shared with patient referred to consultant ophthalmologist. Here I made a little change which I'm trying to work with all the optometrists, one through Ajit Bharajwaj and Mr. Oli in Bombay, and also Tanuja in Botswana, saying that instead of them referring, why not we have a franchise model either from Aditya Jyoti or any eye hospital, where like Aditya Jyoti eye hospital takes responsibility. Maybe if Ajit takes as a partner optometrist, where he'll be a Aditya Jyoti franchise optometry center, where he will examine a patient in Delhi, send the images to the ophthalmologist in Aditya Jyoti, and Aditya Jyoti here, instead of conducting the diagnosis through teleophthalmology, will conduct it through the optometry. And this is my change, which is what I want, and I hope it will work, because it will be a win-win. The patient pays for the professional time of optometrist, and the optometrist pays, collects total and pays the any eye hospital, maybe Aditya Jyoti or any hospital, the professional time for the ophthalmologist. And finally, the solution provided to patient as a one-stop shop, so that the patient need not run around. For example, the Aditya Jyoti diagnosis, because the patient, I don't remember where Ajit is practicing. For example, I can take it as the he's practicing near India Gate, and then he may find an eye doctor who's willing to take the advice of either Aditya's hospital or himself, and takes care and treats the patient nearby, and which is what we want. And then they also charge. And similarly, even charity can be done, where we are doing free treatment in Dharavi. Same thing can be done in the slums of Delhi, XYZ, where. So finally, it's a win-win situation for all the stakeholders, finally keeping patient in mind. And I'm sure all optometrists are governed by their own whatever moral laws, which I think Elite School of Optometry is providing, the various optometry schools providing that they will be trained to use all gadget application of the telemedicine by optometrists, where we use ERG, consultation of patient for low vision aid, referring ophthalmologist for checking retina, all can be done by telemedicine, by teleoptometry. And here you can see the handheld device for refraction with the stand, with stand, and then smartphone based retina imaging. And you see here the one with the Forus, this is Abro with the chin rest, laptop to the left for the operator, here with the Forus camera. And then you have I introduced this nationwide diabetic retinopathy screening as a AOS program called Jot Se Jot Jalao. And this was I've done as the president all over. This is one of the program in Jharkhand, where the minister and the chief minister was there, health minister. We did it in Kumbh Mela, and all this pre-COVID. We have a All India Ophthalmic Society National Committee for Diabetic Retinopathy and Awareness and Screening. This is one of the program by Dr. Jignesh Taswala, Vice President of Maharashtra Ophthalmic Society. We did and then these are the various camps. You can see almost through Remedio, they have screened about 4 million people, Forus about 3.8 million people, Artiles about 72,000, Zeiss about, that time it was the beginning of that, and then Cipla about 7,255. And so finally, we also have a diabetes clinic at Aditya using teleophthalmology. We have Dr. Kiran Shah, who can give the medicine where the patient can pay and get that. And here the main thing is about diabetic patients who are not getting out because of the comorbidity, and they are not able to take care of them. And now we have this new problem, mucormycosis with the diabetes. So with the corona. So I think all this can be done by teleophthalmology. And instead of patient coming from far away to another clinic far away just because they are attached, they can go to the nearby clinic. And I think the shared care will be the modus operandi, which will be helpful. And this is again the field level for doing a camps, and which we can do it with the limited people, like pre-screening awareness, assembly of diabetics, capturing of image and diagnosis by the ophthalmologist, or using the offline AI, which we are doing. And we can also use the posterior segment diseases. The diabetic retinopathy is preventable blind. And the other condition, when you take a photograph of the retina, you can see age-related macular degeneration, hereditary macular degeneration, or any other retinal problem. And 77 million have diabetic. And the International Diabetes says that the prevalence of DR is about, in diabetic retinopathy in diabetics is about 21.7%, published in IGO in 2014. The main problem is lack of awareness of the disease, fairly long asymptomatic stage, and visual impairment occur when diabetic macular edema or proliferative diabetic retinopathy sets in. The selection of screening device, it should be a portable, low maintenance, accessible in lack of power supply, internet connectivity issues, uploading images on cloud data security, ease of data sharing among primary, secondary, and tertiary centers. So this is the remedy on funders. Again, I don't have any financial interest. I showed Forus, I showed Zeiss. It can be mounted on a suitable bike for a transporting for a purpose, and then also it can be charged. And then the selection of the screening device, it should be having a gradability of images with a good specificity and sensitivity. This is on a fundus on phone and Zeiss, comparison between the Remedio and the Zeiss. And the main problem is we have only 1 out of 100,000 ratio for ophthalmologists, and we need about 45,000 optometrists. I don't know how many optometrists are there, which probably Monica should answer. And there are about it's vital that optometrists take charge of primary eye care, and skilled workers taking charge of screening, so that we increase job opportunity, and the eye doctors can concentrate on confirming the diagnosis and treatment rather than doing the screening as well as diagnosing. And here you see Mr. Manish, who's an optometrist, who's using the Zeiss camera, Visicam inside the van, which we have, which we got it from the World Diabetic Foundation. And also we are using the first in the world to use a motorbike for screening for diabetic retinopathy. And this is a van which was inaugurated by Dr. Abdul Kalam. This is inside the van. We have all the equipment. We have Mr. D. Shivanandan, who's was a trustee, and now he supports my eye care. And this is a motorbike inauguration done by my grandmother, who was almost 100 years, which was the first in the world that time. 1st March 2014 it was done. You see Mr. Shivanandan, Mr. Ravichandran, and my father, late Dr. N. S. Sundaram there. And this is again Mr. Zoheb, the optometrist, who's teaching me to use the handheld camera, which is Optomed from Finland, where it connected to the internet. We go door to door and do the screening, and the social workers are there. So this is a small 1 feet lane between the two houses in Dharavi. So I think this way optometrists and ophthalmologists can work together. So the ease of this just show the easy retrieval of data, uploading of diagnosis by the regular specialist, treatment and general advice, and regular interval visits can be done by the optometrist. So the expected outcome is early detection and treatment after screening can reduce the prevalence of diabetic retinopathy even in the remote areas, reduction in economic burden among poor and illiterate people, opportunity for a non-skilled worker to be a semi-skilled worker, and it will help to improve overall health of the population. So financial model for the government, the cost of setting telemedicine, cost of device, cost of transport, cost of manpower, cost of treatment provided, maintenance cost about 10 lakhs a year, which can come down if you can do a mass. So I want every optometrist to take this program, either do it a charity or do it as a chargeable. And I request our leadership development program alumni of All India, Rotary, Lion, Indian Medical Association, Government of India, state government to take part in it. And specifically in this platform, all the optometrists. So we are generations of ophthalmologists. My grandfather, late Dr. Natrajan, my father, Dr. N. S. Sundaram, my brother, Shanbhagraman, who are optometrists, and myself, and my brother is in Chennai, and myself in Mumbai. So I thank my father, mother, my guru, Dr. Badrinath, who happens to be the founding president of Telemedicine Society of India, and I'm the founding president of Teleophthalmic Society of India. And thank my friend, Mr. Shivanandan, the DG police retired from Maharashtra, and finally the God. So I always quote my inspiration: arise, awake, and stop not till the goal is reached. So the goal here is, one of the program which the Teleophthalmic Society can do is to prevent diabetic blindness. What about other problems? So we have a low vision aid. 52 million people have a low vision. So why not we do that through teleophthalmology, teleoptometry? Also do refraction. There are programs like PEAK in Africa, designed by a eye doctor from London, working in Africa.